that the organizers have put together for us. And we have searched to get a competent and the most appropriate speaker to do justice to this. We've gone far and wide to get an expert who cut across our home country, who has served as consultant in General Hospital in Abuja, who is well read, had his master's in cancer science in South Africa, did a lot of oncology in the UK as well, and at the moment he's practicing in the UK. He's not only a doctor, he's also an afar. I remember the last time he led Taraweeh for us. Sheikh, was it like 10 years ago? About 10 years ago, he led Taraweeh for us as well. So he can also do a bit of recitation as well, inshallah. He's a friend. He's a scholar. He's married with 3 slots available. That is the introduction that I was told that they did yesterday. So, and now that you've asked now we've taken it on. Don't worry. Please welcome onto the podium Dr. RIDWAN Oladotun Ahmed. Assalamu alaikum wa rahmatullahi wa barakatuh.
أعوذ بالله من الشيطان الرجيم الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد صلى الله عليه وسلم وعلى أهله وأصحابه وسلم وبعد. أيها الإخوان والأخوات، السلام عليكم ورحمة الله وبركاته. It's a great honor for me to be here among us this afternoon, among my fathers, my mothers, my brothers, my sisters. We give thanks to Allah subhanahu wa ta'ala who has made us Muslims. We beseech his mercies to be on the noblest of mankind, Muhammad sallallahu alayhi wasallam, his household, his companions, and the generality of Muslims till the day of our accountability. Allahumma ameen. Inshallah, the topic I've been asked to discuss this afternoon is chronic diseases and lifestyle. So what is the link between both of them? So inshallah, we are going to be looking at the chronic diseases. What impact do they have among us as Nigerians living in the UK? What is happening? What is the current trend of these chronic diseases among us? Also, we are going to be looking at the roles that lifestyles, what role do they play in the development of these chronic diseases? Also, we are going to be discussing some practical and culturally aligned steps, Islamically aligned steps towards attaining this lifestyle that would prevent us as much as possible from developing chronic diseases. And then lastly, we're also going to be empowering us, inshallah. It meant that this discussion should, birth community engagement among us, such that going forward, we want to take charge of our health and we want to do it together. We want to work together, referred to as non-communicable diseases. So you can't transfer them. It does not mean that the fact that you can't transfer them that they are less dangerous. No, they are even much more dangerous from what the trends have shown over the years. I'm going to show us a table that showed how things have changed, over the years. Now, one thing we know is that there are various examples of these chronic diseases. I gave us some examples of the communicable diseases. So, cancer, for example, is an example of a non-communicable or a chronic disease. Hypertension. Hypertension is when blood pressure is, extremely is high. Don't let me say extremely high because there are different classes of hypertension. So we have diabetes. Diabetes have also got different classifications, but the ones that are, very, very common among us is the type 2 diabetes. So it's also an example of these chronic diseases that we're talking about. Also is stroke, even though stroke is an offshoot of high blood pressure. So somebody who has got uncontrolled high blood pressure can develop at some point. So they all exist together. Also is obesity. Obesity is when we've gained weight beyond the normal limits. Yeah. And there are different ways of checking this. I'm going to teach us a few of them. So COPD. Somebody mentioned COPD. Yes, chronic obstructive pulmonary disease. Yes, it's among exactly coronary artery diseases. Yeah. So all of these are chronic diseases. Yeah. Jazakumullah khairan for reminding me of that. Now I was talking about BMI. So BMI is a measure of obesity. And how does it measure obesity? So we check the weight. Let's say my weight is 75 kilograms, as an example. Then I measure my height. Let's say my height is 1.65 or 1.67 meters. So the way I calculate my BMI is that weight, I divide it by the square of my height. So my weight is 75, my height is 1.67. So 75 divided by 1.67 squared. So whatever I get is my BMI. Now, the classification of this BMI is now what is defined as obesity. And the class is that if you calculate yours, let's do it. It's a practical exercise now. Do we know our weight? Each of us should know our weight. And it starts from there. If I ask us, when was the last time you checked your weight? It's been a while. Yeah, we should be monitoring it. We should have a weighing scale at home. We should buy a weighing scale. Periodically, we check our weight. What is the weight? So that if our height, is as adults is fairly constant. We don't add height, after we've passed the age of 20, 22, 25. It's constant above, the age of 20 to 25. So the height is constant. So if you check your weight, let's punch in our weight. Let's divide that weight by our height. So do we know our height in meters? I'm talking about height in meters, not in feet or, yeah. It's easier to calculate in meters. So who wants to tell me what their own result is? Weight divided by square of height. No, square. So we need to divide it again by 1.65. So if you can't do square, you can say 80 divided by 1.65 divided by 1.65. So 29. Excellent. 32.9. Good. Who else has calculated theirs? Among our sisters, our mothers. Okay. Now, so if you are looking at that calculation, what does it? How do we interpret the value we've got? So if your BMI is called body mass index. If your BMI is less than 20, In fact, some people would say that if it is less than 18, even though less than 20 is still agreed to be this definition I'm about to mention, it is said to, the person is said to be underweight. Yeah. Yeah. So less than 18 or less than 20 underweight. Now, if it is between 20 and 25, 20 and 25, that is the normal. Yes. 20 to 25, that is from 21, 22, 23, 24, 25. That is normal. Now, between 26 to 30 is overweight. Between 26 to 30 is overweight. Now, anything above 30 is classified as obesity. Now, obesity itself is further classified into mild, moderate, and morbid obesity. So, mild obesity would be from 30, above 30, say 30.5 or 31, 32. So from 30 to 35 is mild. So the person is obese, but not too much. So we can, we can still put in some effort, to bring it down, to reduce it. Between 36 and 40 is said to be moderate obesity. Now, anything above 40 is said to be morbidly obese, morbid obesity. Yeah, morbid, morbid. Yeah, morbid. So anything above 40 is said to be morbid obesity. So like we should all know how to calculate this. Our weight divided by the square of our height. If our phones does not have scientific ones, we can, if your weight is 70, your height is 1.65, you can say 70 divided by 1.65 divided by 1.65. So you divide it twice. So it will still give you the answer. So we should anything above 40 is morbid obesity, and this is what predisposes to some of these chronic diseases that we are going to briefly talk about. In the slides, I didn't want to bore us about going through each of the diseases, because I'm a trained oncologist. So we will talk about, if we want to delve into each of them, we will start, and several hours we are still discussing them. We haven't exhausted them. So the aim of the talk is not to bore us with the scientific jargons, of each of these chronic diseases, but to arm us, with information, and to challenge us, on why we need to take charge of our health so that we are, healthier, going forward. Now, thank you. Yeah. So this is the table showing us the major diseases, that causes death, over the years. You can see that the paradigm is changing. What was causing, death in the 1900 is not what is causing, major causes of death in year 2000, and above. In the 1900, when there was no discovery of penicillin, there was no discovery, of antibiotics that will cure, communicable diseases. We have communicable diseases, as the main causes of death: pneumonia, tuberculosis, diarrhea, diphtheria, which is childhood, communicable disease. So all of these were causes of death in those periods. But going back from year 2000 upwards, we now know that heart diseases, different heart diseases are now responsible, for causes of death. Cancer is responsible for causes of death. Cerebrovascular accidents, otherwise known as stroke, responsible for it. Chronic obstructive pulmonary disease, which is a form of respiratory airway disease, is one of the major causes of death. Diabetes, especially type 2 diabetes, is one of the major causes. Pneumonia still kills, even though we have vaccines, we have antibiotics that can effectively cure it, but it's still one of the causes of death. Alzheimer's, is when it is common among adults, is a general term, for chronic dementia. People who are elderly start, gradually losing their memories, losing their personalities. Somebody who is very active, very agile, the person starts withdrawing, personality changes, they can't remember people, they are struggling to get normal things they used to do. They are now struggling to get it done. That's what you call Alzheimer's disease. And then chronic kidney disease and septicemia. Septicemia is when there's a chronic infection that has spread throughout the body, now shutting the body system down. So all of these are it's the same thing. So septicemia is when it has spread around the body. So sepsis is when the body temperature is above normal as a result of a bug. So maybe an infection, for example, or maybe cancer patients who are receiving chemotherapy, they can have sepsis because their immune system is down at that point when they've received chemotherapy, and so on and so forth. So, but when that infection, when it becomes disseminated, affecting the entire body system, it becomes what we call septicemia. Next slide. Now, so the chronic diseases in the UK, we now know that the top four causes of common chronic diseases within the UK are hypertension, diabetes, CVA, and cancer. These four. Now, these four chronic diseases, the funny thing is that the statistics, the data among us, blacks, is actually terrible, is worse. So in other words, we blacks, each time we have any of these chronic diseases, we have it worse when compared to our white counterparts. So hypertension, when we have it, our own is usually much more severe. Same thing with diabetes, we have more complications. Not just we blacks and also the Asians, actually. But we blacks, sometimes we tend to fare worse. Same thing as cancer. Look at the leading cancers that we have in the UK. The leading cancer that we have in the UK, it used to be lung disease, lung cancer before. Now breast cancer has overtaken lung cancer. Within 2-3 years, breast cancer is now the number one, the commonest cancer in the UK. And it affects, in over 95% of cases, breast cancer affects women. It also affects men. So we are not immune to not having it, but less than 5%, of breast cancer cases occur in men, and in those 5%, the black men happens to have more than other races. Same thing with if you look at prostate cancer. So I've talked about breast cancer. Breast cancer is the commonest female malignancy, even though it's the topmost. If you combine all cancers, it's number one. Prostate cancer is also very common, and we now know this one is not just in the UK, even in the US, globally. Prostate cancer is deadlier among black men. In fact, there was a study which I published about 2-3 years ago. So where we were comparing the incidence of prostate cancer among Nigerians and South Africans. We now know that Nigerian men actually have higher risks of developing prostate cancer, and our prostate cancers are usually more aggressive, than even the South Africans, and even than white men. And that is why when we see prostate cancer patients presenting in the clinic, the black men, their outcome is usually worse compared to the white. There are various reasons. I'll cite some of them. One of them is that our health-seeking behavior as black people is poor compared to the white counterparts. So our health-seeking behavior, this is likely to be cancer. No, 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 no. Cancer, no. It's not my portion. It will never be mine. Do you know? Okay, it is confirmed. Ẹ má lo nǹkan táwọn doctor yẹn sọ fún yín o. Àwọn oògùn wà, àwọn èpo wà, àwọn kìíní wà tẹ́ pé àwọn egbòogi tẹ́ pé ó máa gbẹ gbogbo ẹ̀ dànù. And we start using that. By the time it has now become a disseminated disease, spread around the body, there's no cure again. You know, it has metastasized, yes. It's called metastasis. Spread around the body, then there's no cure. Prostate cancer is curable if it is caught. In fact, most cancers are curable if they are caught very early, except for some cancers that are very terrible news. Yeah, even we oncologists, we know that they are terrible news. Pancreatic cancer, for example. Cancer of the pancreas is a terrible one. Even if it's caught very early, it's still not a surety that it will be cured or that it won't come back, in a few years. Yes, even if it is removed, it may still come back. Even though, like I said, all cancers, catching them very early can guarantee cure. In fact, there are some cancers that are stubborn. Pancreatic is one of them. There are some that can actually, even if they are caught in stage 2 or stage 3, they can still be cured if we present, to the hospital, in time. Like anal cancer, for example, prostate cancer, for example, even breast cancer. Some of these cancers, they've now become chronic diseases. That is disease that you can live with for a long period. It won't kill you, but if you manage your lifestyle well, you would be living your life normally without affecting you. So this is where the treatment of these diseases are getting to now. But it takes so many things for them to be chronic. Chronic in the sense that they are not terminal. Because when a disease is said to be terminal, it means that there's no cure. The person is weeks or months to die. So those are called terminal diseases. But some of these cancers can be managed so that you can control them, live with them as chronic disease, and for several years down the line, nothing would happen if you're going for your follow-up using the medications as they are supposed to be used. Now, what are the likely causes of these chronic diseases in our midst? So I was talking about paradigm shift. Look at our house culture. Things are changing. In the past, ni àwọn mama wa, àwọn bàbá wa lóko, ara wọn máa ń jí pépé torí pé gbogbo nǹkan táwọn máa ń ṣe, wọ́n máa ń tó bá fẹ́ ṣe oúnjẹ, energy, wọ́n máa fi gbogbo ara wọn máa fi ṣe, wọ́n á wági, wọ́n á dáná, wọ́n á ṣe kíní. Gbogbo wọn kíní yẹn ó jẹ́ kára wọn kó dá pépé. Oko wọn ó lè jẹ́ pé bí i 5-10 kilometers away. Very active, exactly. So wọ́n are very active. So wọ́n á lọ sí oko 10 kilometers away. Wọ́n á rìn lọ. Ẹlòmíì tí ò ní rìn lọ, wọ́n á gun kẹ̀kẹ́ lọ. Wọ́n á tún gun bọ̀. So àwọn kíní yẹn ó jẹ́ kí ara wọn kó ṣe kíní o, kó jí pépé compared to ours. We now have, even though life is easier, but it also comes with its own side effects or with its own adverse effects. So we now do everything. You don't have to stress yourself going to fetch firewood, going to the farm, you can do everything, under the comfort of your room, stressing yourself less, but accumulating those things in your body, gaining weight in the process. Also is field work, desk jobs. In the past, those active jobs, that would make us sweat, lose weight, expend much energy. Now things are you don't have to, it's in the office, under AC in the car, AC in the office, AC back home, AC at home. So that is how everything is remote controlled, you know. So next slide. Also, if you look at children, you know, when we were small, we do every forms of outdoor play, you know. In fact, I'm a JP, I'm a shakini. Those eating those hands, you know, scientifically, it's been proven that they have a way of strengthening our immunity. And that is why today, in this environment, we are very overprotective. Oh, don't do this of our children. Oh, don't do this. Don't go and play. Don't go and. Whereas those plays are what will strengthen the immunity of those children. You know, look at it today. No, everything is indoor. They play game on their iPads, on their tablets from morning till night, gaining weight, you know, and not having a way to lose it. Also, is our food culture. In the past, we eat very healthy foods, fresh foods. To just say, as alomu alati oko, everything is fresh. Bashen wa iṣu yẹn náà ni láti ń bẹ, láti gbé sórí iná, láti fi gúnyán àbí láti fi jẹ iṣu àtepo àti jẹ bẹ́ẹ̀ tó dẹ̀ tá ṣara lóore lóríṣiríṣi. But today, we have so many junk foods. Foods that you just on your phone, pim, oh yeah, order. They will deliver it. Uber it. You know, Deliveroo, they will bring it to our house. You know, so all of those things are contributing to, you know, how the paradigm is shifting in terms of our health. Also, you know, is that we adopt unhealthy lifestyle, you know, that our diet is so poor that it's not balanced as it should be. We don't exercise. And this is what this it's something that we need to look into. Look at the whites. You see them exercise. You know, it's a lifestyle. Marathon, exactly. They do marathons. They participate in all these activities that would even you see somebody who is above 70 still doing, you know, running almost every day or every other day. Running kilometers, hundreds of kilometers, you know. So, and then substance abuse, like smoking, like alcohol, you know, which are having negative impact on our health. Now, you see, I was talking about these chronic diseases. There are sometimes you may, and that is why we need to be prayerful. There's a dua towards the end of maybe on the last slide or so of the lecture. Even if you do all of this, you are very active, you are doing exercise, you're eating right, it doesn't mean that you can't have these chronic diseases. Yes, you can have them. However, the risks can be cut down. If the risks would say be 100% or 80%, you can cut it down to like maybe 30% by, you know, living your lifestyle in a good way. It doesn't, look at what I said. I said from 80% to 30. I didn't say 0 because you cannot cut them down to 0. And I'll give you some practical examples. I know people who are very, very conscious of their health, who do everything that they are supposed to do. They eat right, they exercise, they do everything, and they still come down with cancer or with diabetes or with hypertension. They still come down with these diseases. And the reason is because it is not just lifestyle. So some of these things are also, you know, by genetics. And this is where we as blacks, this is where we are disadvantaged. Because in our family, some of these diseases are there, but because so we do not know. Because health is not something that is very that is everywhere in, you know, yeah, it's not well promoted back home. So Emari and family, they will say, on bi abiku mewa no bi ki kan wa to duro. It is resource incompatibility. The woman is resource negative. Husband is resource positive. Resource is a type of blood, you know, blood type that we do. Now, because of that resource incompatibility is happening to the children. So each baby they born, if that baby has positive results, there'll be cross reaction, and that baby will die. They will die. They will continue until, and that is why some of us women who are resource negative, they usually give us this injection called Rogam, anti-D. Yeah, it's also called anti-D. Yeah. So anti-D Rogam injection, which helps, whatever antibody that might have been inbuilt in our system from the from the resource negative during our pregnancy, we receive that anti-D to counter it for our next pregnancy. But this is not something that we know. Abiku no ni, abiku yen no ni. O down lamu gan. Or in the village, when you see somebody who has suddenly gone blind. Àwọn ayé náà ni wọ́n dẹ̀ ṣe wá báyìí. Wọ́n dẹ̀ rí wa, wọ́n ṣe wá. Whereas this is an old woman who has got type 2 diabetes, has got what we call diabetic retinopathy. The retina, so retinopathy is one of the complications of diabetes. It has been happening gradually, and ojú yẹn ń ṣe mí bákan, but ojú yẹn ń ṣú, ó ń gún mi, and before you know it, blindness. So, or blood pressure, hypertension. And this is why that lifestyle of checking our blood pressure. If I ask us what is your baseline blood pressure, you should know. Okay? Kidney blood pressure, if you are above the age of 40, tabati ju 40 law. This is when, especially we as black, race, ìgbà yẹn àwọn àìsàn tá à ń sọ yìí no man wọlé tọ̀ wá wá. Èèyàn lè má ní àwọn àìsàn yẹn tẹ́lẹ̀ before 40, but once you clock 40, PSA check. PSA is prostate specific antigen, which is a surrogate marker, a blood test that we use to screen for prostate cancer. Above 40, you should have one checked. Now, if you have checked it before and it's fine, about 2-3 years after that, let's check again. And if your GP says, but we did it 2 years ago, tell them, I learned my risk is more as a black man. Please, I want to have it checked. If you say that to them, they won't turn you down because they know you can sue them with that statement. It's a statement of fact. We've had some people that their prostate cancer was caught because of their own insistence on getting screened. Yeah, I want to do it. And by the time they did it, everybody is panicking. This level is higher. Let's check further. And by the time they will check further, it's in the very early stage that can still be cured. And the person can be in remission for several years without that disease killing them. So, yeah. Now, there are all of these chronic diseases. I spoke about genetics. I spoke about the lifestyle. Now, somebody once said that if you're talking about health and disease, that the development of disease can be likened to a gun. That our lifestyle, that our genetics is the gun. Our genetics is the gun that can cause the disease. Now, the trigger of that gun, that once you push it like this, it will kill and cause havoc. That trigger is our lifestyle. So which means that some of us have some genetic conditions. You can't change that. You can't change your genetics. If your father is type 2 diabetic, or they've got prostate cancer, or maybe from the mother's side they've got breast cancer, you can't change that. It's not what you can change. So the fact that you have parents who have hypertension or diabetes, that risk is there. So that risk is like the gun, which means that you should be more worried that baba me only diabetes or mama me need blood pressure. You have to take charge of your health to screen for those conditions because you can develop them. So lifestyle is now is the trigger. If you're not reckless with your lifestyle, then that means the gun is there before. So you just pushed the trigger with the reckless lifestyle, and the gun shoots, and the disease starts. So that is how it is. So genetics we can't change, but lifestyle we can change. So if you can change that lifestyle, which is the trigger, it means that the gun will be there. If nobody pulls the trigger, it won't kill. It's not active. It won't really do anything. Okay? So if you are looking at the 3 pillars of health, so we have sleep, exercise, and nutrition, diet. These 3, even though they seem very simple, but they are the backbone, the bedrock of a very good health. And that is why sleeping as an adult at least 7 to 8 hours minimum. Yes, Bill Wambe, I'm a lot of shift. Yeah, which is understandable. It's understandable, but all those periods that we are free, that we are not going for night shift, let's ensure we catch up that sleep and sleep it. Otherwise, the body has a way of requesting for it, and it will get it back if you don't give it to the body. Exercise, keeping active, moving. Now, WHO has changed their definition of exercise and what they imply by exercise. You don't have to be doing rigorous exercise. You don't have to do that. Exactly. That's a very good one. Yes. Instead of going to car wash, washing your car yourself, trekking to the mosque, you will sweat it out. You would trekking. If let's say the mosque, if you drive to the mosque, is about 5 minutes away. Trekking may take about 15 minutes. Trekking there, coming back, that's like 30 minutes. All our smartphones, our smart wristwatches, they can track the number of steps that we take each day. And the minimum minutes that is said that we need to be active now, if it's been revised to 150 minutes per week. 150 minutes per week, which means that at least 5 days, you should be active for 30 minutes. Out of 7 days, 5 days, make sure you're active. And that activity doesn't have to be that maybe you're not lifting heavy weights. Walking, brisk walking. Can you come on? Brisk walking is a good one. Exactly. Kí ẹ máa vacuum inú ilé. Kò ń ṣe àwọn ọmọ nìkan. Lọ ṣe kí ní ẹ̀fín lọ ṣe. Káwa náà dìde. Káwa náà ṣe àwọn activities yẹn. Ìyẹn náà bẹ́ẹ̀ ni. Ìyẹn náà wà ń bẹ̀. Bẹ́ẹ̀ ni. So punching ara ẹ̀ náà ni gbogbo ẹ̀. So diet, exercise, sleep, stress management, they can impact on our health. Poor habits increase risk. Poor habits can actually increase the risk and make sure that we do not have good life that we are supposed to have. And we know Allah subhanahu wa ta'ala in the Quran, chapter 7, verse 31, Allah encouraged us, that wakulu washrabu, that we should eat, we should drink. Wala tasrifu, atusrifu, innahu la yuhibbu musrifin. Pé ká ṣe kíni o, ká jẹun, ká mu, wala tusrifu, we should not be excessive. Torí pé Ọlọ́run bá ó kórìíra àwọn tí wọ́n are very, very wasteful. Now, next slide. Okay. So, àwọn oúnjẹ wa, they are very, very, very good. Very, very good. Even though I know the excuse may be that but àwọn TB, àwọn yẹn wà cheaper. Bẹ́ẹ̀ ni wọ́n wà cheaper, but àwọn nǹkan tó ń dálẹ̀ lára wa, and especially for those of us who are tẹ́pẹ́ àwọ̀lú yìí ní ẹni tó ti maybe above age 30 or age 35. Àti dìgì ẹja tó já sí pé you can't àti ẹ̀dàgbé tó pé kò ṣeé ká. So lifestyle that is ní láti Nigeria is there. After abẹ́ tọ́ra wa jẹ lókù pé mi náà fẹ́. So àwọn oúnjẹ wa ní Nigeria yẹn, àwọn studies have shown that they are very, very good. They are very nutritious and they are good for our health. So as much as possible, ká gbìyànjú pé kí ni o, pé and in a balanced way, because tabawa oúnjẹ ọ̀pọ̀lọpọ̀ oúnjẹ wa ló máa ń ní carbohydrates as a backbone. Carbohydrate itself is not bad, but if you to just tabani diabetes, we have to check it, because carbohydrates ní nǹkan tó ń fuel sugar control wa tí ò ní jẹ́ kó wà controlled. Àbí àwọn taba ní nǹkan tó pè ní pre-diabetes. So and this is something I want us to take serious. So when we say diabetes is we've got what we call type 2 diabetes mellitus and type 1 diabetes mellitus. Type 1 ni to ma affect àwọn ọmọdé. Only affect ọmọ oṣù mẹ́ta, ọmọ oṣù mẹ́fà. But type 2 àgbàlagbà nìyẹn sábà máa ń affect. So type 1 yẹn ìdí tí yẹn fi máa ń ṣẹlẹ̀ ní pé nǹkan tí ó máa ń produce tó máa ń mop up sugar tá bá jẹun sìn, tá bá jẹ bẹ́ẹ̀ ajẹ ẹ̀bà. Ẹ̀bà has lots of calories and it's a carbohydrate. Tẹ́bà yẹn bá ti ń dénú wa, it will be absorbed into our bloodstream. Now, tó bá ṣe ń dé inú bloodstream wa, there's an enzyme called insulin. Insulin yẹn, organ tó máa ń produce ẹ̀ lára wa is called the pancreas. Pancreas yẹn is situated between, so tó ń jẹ bá lọ lọ́nà fún wa, which is our esophagus, ó máa débi stomach. From the stomach, it will go to what we call duodenum. Duodenum yẹn, is C-shaped. So that duodenum, which is C-shaped, there is pancreas is a structure that emerges from that C-shaped, embedding itself along our duodenum. So that pancreas here will produce insulin. Islet cells of Langerhans. They are the ones that produce insulin from the pancreas. Yes. I think not on science that shit. Okay, now so insulin here, if it is completely absent, such that pancreas maybe over defective, insulin were produced. You know, when type 1. Because insulin lo manje ki sugar level, ko shekini o ko lole. Now in type 2 diabetes, any pancreas produce insulin. Ṣùgbọ́n ara ẹni yẹn ó refuse láti recognize insulin yẹn. Even though the body is producing insulin, but that insulin is not effective to bring the sugar level down. And that is when it becomes a bit tricky for type 2 diabetes. Ìyẹn irú ẹni bẹ́ẹ̀ láti gba kékeré kò ní problem, kò ní anything. But can it ti wà nínú family, maybe the mom or the dad or the granddad, they are diabetic. The person may also have that diabetes at some point in time in their lives. And that is why for such people who have got history of diabetes, there's what we call pre-diabetes. So pre-diabetes is the person has not developed type 2 diabetes yet, but the value of the blood sugar measured either through what we call HbA1c, glycated hemoglobin. So HbA1c is like is a parameter tí a fi máa measure sugar control. Ẹ̀jẹ̀ wa no man check tó bá ti wọnú ẹ̀jẹ̀ wa. What they are testing is that àwọn ẹ̀jẹ̀ wa ó contain hemoglobin. Hemoglobin here is a red pigment tó máa ń gbé oxygen tá miss inú yẹn. It carries it round our body. Now the way glycated hemoglobin is measured is that within the last 3 months, those hemoglobin, they also have sugar coats on them. So we are now checking for the sugar that they've stored on their surface over the last 3 months. So that is what glycated hemoglobin. And it's not just pricking ourselves and checking the blood sugar, even though that is the usual one we know. But the most objective way of knowing is this glycated hemoglobin, because it checks over our glucose level over the past 3 months. So it tells us, the glucose level is fine. Normally, it should be below 47. If it is above, then so there are discrepancies actually. Some people would even come down to 40. But we know that between 40 and 45 is normal. Now, if it is above 45, 46, 47, or 48, it may be what we call pre-diabetes. The person is not diabetic yet, but umbo, Yorùbá sọ pé àwọn la dead. So it's coming. It's coming. So because it is coming, we need to, that person can get screened, can adjusting their lifestyle can reverse that prediabetes, and they will never develop the diabetes. But if you don't screen for it, would you know? You will never know. And that is how most people who have developed diabetes today, that they were pre-diabetic for a long time, but they never knew, because they never knew what was pre-diabetes until that pre-diabetes now became diabetic. And you know, the way diabetes is, of course, there are some common symptoms, like you'll be eating, overeating, you'll be eating excessively. You'll be eating, polyphagia, excessive eating. You are finished eating, you are hungry again. You are hungry again. The other one is what we call polydipsia. The person will just be urinate. And then, or excessive thirst. Now, these are the common ones. There are some people, they will not have any of these symptoms, and they will develop diabetes. There are several people I personally know. No symptoms. No symptoms. They were fine. They just went for a check. I know of somebody that it was during World Diabetes Day that he checked, and the blood sugar was over 500. They're like, In fact, it was the first reading was 500. The next one was unrecordable. And this person was fine, moving about, doing normal activities. You know, so because the person was never symptomatic. So diabetes may happen without you having any symptoms. So the only way by knowing is by getting screened, by doing the checks that we are supposed to do. So in terms of our diet, eating our halal. Now, yeah. So eating halal, eating, good food, vegetable, beans, millet, reducing our sugar, reducing our salt. Salt, we now know that sodium, is one of the causes of high blood pressure. It's the major culprit. And then Mabo say onje taba shel amabuyos magi lẹ́yìn magi atuma fiyosi atuma ajinomoto. So all of these are factors that have been implicated in the development of high blood pressure. Next slide. Kama gbawe, Monday, Thursday. In fact, the funny thing about the Sunnah fast of Monday and Thursdays is that we now have studies, research that not done by Muslims or by non-Muslims. They are called, you can Google intermittent fast, benefit of intermittent fasts. Islam otifunwa several years ago. So in fact, there was a study, I was reading the outcome of that study, and they found out that if you are fasting, you don't need to fast every day, because that one is also dangerous to your health. But if you do it intermittently, you fast today, you break tomorrow, or you fast just like Monday, Thursday that we know, or the 13, 14, 15, Ayamul Bayd, when the moon is full of every lunar month. If you do all of those sunnah, you'll be very, very healthy. Because Allah, who knows us and has prescribed all of this, for us, knows that they are very good, for us. The Prophet ﷺ encouraged walking, archery, sports, various sports. Sedentary lifestyle is our challenge. TV unlike in Nigeria, here ibitan be ojino sira won a ko le kugiri pe mo fe sare lo ki enikan abi fe sare en to fe lo ki gan ti lo bi ise abi. So all of those are challenges, but in our local community, in our mosques, we can come together to. Next slide. So rest for a healthy body. I've spoken about this. Oilula is the short nap. Sunnah nabi ni ke ma sun losan. kéèyàn take short nap sallallahu alayhi wa sallam yes kéèyàn take rest 30 minutes to 1 hour is a very good one, but some of us about we even scold our no, we shouldn't, because it is sunnah, you know. So next one, I've touched all of this. Yeah. So smoking, substance abuse, as Muslims, we have to, move far away from them. Stress management, Quran, Kenyoma. In fact, there are studies now which now shows that if you are meditation ni pé kéèyàn jókòó, kéèyàn dẹ̀ máa ronú deeply, that it can boost your mental health and your overall health. Àwọn tó máa ń ṣe yoga, they take yoga forward by doing some forms of meditations and all of that. Gbogbo àwọn kìíní, Islam ní ká máa ṣe tadabbur, tafakkur. Al-Quran wa ká máa ronú sí, ká wá kí l'Ọlọ́run máa ń sọ mí bá. Àwa tá a bá gbọ́ Lárúbáwá, English, ká kí l'Ọlọ́run bá. Mo ní ọ̀rẹ́ kan tó já sí pé ẹ mọ̀ pé tí Ramadan máa ń bọ̀, eré tí gbogbo ta máa ń sá ni pé mo fẹ́ parí Quran 6, Quran 4, Quran. Òun sọ pé ní Ramadan tó ń bọ̀ yìí, nǹkan tẹ́mi fẹ́ ṣe ni pé torí pé mi gbọ́ Lárúbá, nǹkan tí mo fẹ́ ṣe ni pé mo fẹ́ ka Quran pẹ̀lú meaning ẹ̀ láti òkè délẹ̀. Nǹkan tí mo fẹ́ ṣe nìyẹn. Mo fẹ́ ka kí n dẹ̀ mọ̀, kí n wo ìtumọ̀ látòkè délẹ̀. Tí wọ́n ní kí n béèrè lọ́wọ́, wọ́n sì ń pé mélòó ni wà láti ka Quran, kò ní pé ka Lárúbáwá ta parí bí 2 3 o, láti kà á pẹ̀lú ìtumọ̀ láti òkè délẹ̀. So bẹ́ẹ̀ni also bẹ́ẹ̀ni so that meditation boosts our mental health. Torí pé à ń ronú sí nǹkan t'Ọlọ́run máa sọ, àwọn pé so eléyìí náà tún wà ní Quran, kí ni Quran yìí yóò wá tẹ̀ wá sọ, Quran tún sọ eléyìí náà, ó tún ṣàlàyé eléyìí náà tún. So all of this would help us. Next slide. Next. Okay, àti sọ̀rọ̀ nípa eléyìí. Next. So I know àwọn kan máa ń sọ fún wa pé smoking níbo l'Ọlọ́run bá ti sọ pé a lè mu sìgá àbí eléyìí tá bá wo. In fact, there are so many. The slide before this one, Ọlọ́run alayhi salam ó sọ fún Ọlọ́run náà dẹ̀ sọ fún wa ká má ṣe ṣùtá fún ara wa. So ìmá ṣe ṣùtá fún ara wa òun ni smoking cigarettes has been implicated in most health conditions. Kò ń ṣe cigarette nìkan, igbó, gbogbo, all those substance abuse. Smoking is the number 1 culprit of lung cancer. Somebody who smokes cigarettes has 20 times risks of developing lung cancer. 20 times compared to somebody who does not smoke. If you don't smoke cigarettes, your risk of developing lung cancer is 1/20. But ẹni tó ń smoke 20 times risks. That is lung cancer. Look at blood pressure, diabetes, stroke. There is no mention any of these chronic diseases, any of these non-communicable diseases. Smoking is their number 1 cause. Same thing with alcohol. Of course, Islam ti sọ fún wa pé ká jìnnà sí alcohol. So rijzun min amali shaitan fajtanibuhu. There are deceptions from shaitan. Innamal khamr in Quran chapter 5 verse 90. Suratul Ma'idah. So gbogbo àwọn eléyìí ọ̀nà tí èṣù tó máa ń fẹ́ fi lead wa astray ni. So we have to somebody said alcoholic liver disease. Yeah, true. The hepatocellular cancer. They mention it. Alcohol is even cancer. Either colon cancer is there. Smoking, alcohol, they are culprits. So aligning. Okay, next slide. Adiso àwọn eléyìí. Okay, I've explained this slide, I've explained it in a way that if, like this case is a man who had type 2 diabetes. The other person who had pre-diabetes, and they were able to reverse their diabetes through diet and through lifestyle changes. Now, the other slide, what it is telling us is that, sorry, before, no. This one. So can you reverse type 2 diabetes and pre-diabetes? Yeah, so diabetes, you may not, I don't want to say cure. Most of these non-communicable diseases or chronic diseases, they are incurable. But like I said, you can keep them in remission. Automatically remission. Remission is that even though the disease, you have it, but it's not doing you anything and it's not showing. If you do blood tests, it's normal. Everything is normal. But the fact that you've had it before means that you had it before. So, thank you. Because of see me, Sarah. So yeah, see me, Sarah, you can see me, Sarah, forever, and it will never rear its head. Whereas if our lifestyle, which we say is the trigger, if we are not careful with it, that remission can bring it back if we are not careful with our lifestyle. So in terms of can we reverse it? Yeah, we can reverse it with healthy eating, portion eating of our carbohydrates, with weight loss, with exercise and medications. Some people who have type 2 diabetes, they will start with medications and they will be having these lifestyle changes. Gradually, the doses of their medications, they will be dropping it till they'll say, yes, you are doing well, don't use medications again. Only food is what you'll be using to control it. So it's very possible. We said it is not a cure, but you can live with it for a very long time. So if you take action, next slide, this is a possibility. Next slide. Okay, so collectively, our that we live close to ourselves, we need to take communal actions together. Àti sọ̀rọ̀ nípa diabetes, àti sọ̀rọ̀ nípa blood pressure, àti sọ̀rọ̀ nípa cancer. Some of these screenings, as a community, we can partner. We have some cancer charities. So just you can invite them. Come watch a screening for you. One buy in sorrow. One call materials, educational materials. Macmillan does it. Prostate Cancer Research UK does it. Several other organizations in the UK. But individually may not be feasible. But if you do it collectively, we can organize it in our various mosques. We can do, breast screening, cervical cancer screening. In fact, anybody who is above the age of 25, you would receive cervical cancer screening from the GP through NHS. Cervical cancer, that is another deadly one, even though in the UK maybe less, but if you look at those who are having it, Asians, blacks, because cervical cancer there are some countries that it is almost eliminated. Because cervical cancer, there are vaccines that we now know that once you have those vaccines given to both boys and girls, you can reverse it. Countries like Australia that started, they call them HPV vaccine, human papillomavirus vaccines. So Australia started over 15, 20 years ago. And now they are almost at the verge of being the first country in the world that are eliminating cervical cancer. So the rate is very low, less than 2% in Australia now. So some other countries too are on that. I know some of us have misconceptions. Vaccine, it will cause this, it will cause that. Most of those things are misconceptions. Some of them are founded. I'm not dismissing all of them, but most of them are actually not. One thing is, there is no medication without side effects. So most medications have side effects. But what we normally look at is that what is the risks versus benefits? And in the research, that risks, what is the percentage of those who developed it. And that is what we use to make our informed decisions when we're advising you, in clinics. Okay, so we've spoken about this. So screenings, prostate-specific antigen for us men, breast cancer screening. Even though breast cancer screening is not mainstream, they won't screen you. The main screening method is mammogram. And in the UK, if you are not above the age of 60, not even 50, now we are fighting that they should lower it down. If you have any family risks, maybe your aunt or your any very close relative member, if they've had breast cancer before, let your GP know that I have a family risk. You are not the one that they will delay till you're 55 or 60 before they start. They need to start early. Any of these chronic diseases, if you have anybody who has had it before, let's voice out. They will listen to us. Okay? Yeah, next one. Next. Okay, so we've spoken about all of these. They are preventable, they are manageable. Diet, exercise, sleep, stress management are key pillars. We need to align our health practices with Islamic values and our Nigerian culture, and we take advantage of NHS services and our community support. Small changes. You may think that, is this small thing I'm doing? Those small changes, if you are consistent with it, leads to big results. My last one, to make us understand it much more than the way it has been delivered. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa barakatuh. Takbir. We thank Dr. RIDWAN for that insightful, thought-provoking, and informative lecture. Ask Allah to make things easy. Accept it from Him as act of worship. We are at a crossroad. All of us. The organizers have, in their magnanimous act, they have informed me that we have earned 30 minutes break. So we can relax, do whatever for 30 minutes. However, we could stay here and ruin that 30 minutes with questions. That 30 minutes starts from 4 o'clock to 4:30. So we will take questions, but to make life easy for us, hello, ask to the line, please. No preamble, no gesticulation, no how it happened. The question, what is this? 2 seconds, Kalas. 1, 2, 3. Please, so can I have the second mic, please? So if there is preamble, I'll cut the person off, please. Alaji, please, question, straight to question, please.
Assalamu alaikum.
Okay, Alaji, one, Alaji. About 2, 3, 4, 5, 6. We have 6.
Thank you very much, Dr. RIDWAN. My first question, I have 3. The third one is an observation, but the first question is, you have mentioned sleep as one of those factors that helps in terms of health. Some of us have it difficult to achieve 7-8 hours. The question is, can we use pills to cover up so that we can sleep very well? Or take a lot of chocolate so that we can be weak and sleep well? That's question number 1. The second question is, we have had, and we don't know whether or not it is true, that if you have regular sex, you are unlikely to have prostate. The other one again is it true that if a woman does not have sex she does not have the risk of having cervical cancer. That is
It might be a while.
I mean, it's a question that if a woman does not have a regular sex, she does not have that risk. My last observation, we have been saying black men, we are prone to this, we are prone to this. My observation is even kain in Nigeria, ota in your lara. If you sit on kain of London, it will not bite you. But if you sit on kain of Nigeria, it's going to bite you. So it's like termite. Termite is just insect. So that's my observation. That is it possible for the medical world to actually go into investigation as to whether it is the sun that we are exposed to as black people that is making us vulnerable to all these diseases? Thank you, sir.
Okay, thank you. Doctor, we take all questions, yeah? Number 2.
Assalamu alaikum. Yeah, we understand that when we were growing up, I belong to and today it's all about Western culture, Western medicine here and there. Okay, my question. How far can you encourage us to use all this Chinese medicine, Orthodox medicine, to sort out our health issues more than the Western medicine? Because about GP, don't go and take any Orthodox medicine, no. Take water and paracetamol, and this paracetamol will come over. That's my phone.
Sir. The question is noted, sir. Thank you, sir. Number 3. The question is noted now. Number 3. And you call Elijah number 3. Emma Binu, sir. What is your question? What is your question now?
Assalamu alaikum. You talked about BMI. On whose bodily structure was BMI developed, please? And how is it relevant to us Africans?
Thank you, ma'am. Alaji Adeyemo.
Okay, my own question is that there are some things that Prophet Sallallahu Alaihi Wasallam encouraged us to have in our kitchen, and I want to know the relevance of each of these, if there is any, in terms of all these diseases we're talking about. First, he said we should refrain to a large extent from eating red meat, 1. That we should keep vinegar in our kitchen, 2. That we should also be eating olive, 3. I think honey, we know that generally. So what are the impact of all this in relation to all these diseases? That's my own.
Thank you. Alaya Chalewa.
Thank you. Lifestyle changes surely affect, what was we talking about? High blood pressure? Is that reversible or could it be stemmed?
Thank you, ma'am. Alaya Sherry.
Salam alaikum. If you have genetic high blood pressure, right? That was the same question I wanted to ask. And you're on medication. After a while, is there a chance that you will ever go without the medication?
Thank you. Those are all 6. Elijah, we've... last one, briefly.
Salam alaikum.
Alaikum salam.
Please, I want to ask about.
I
I want to ask about the sleeping. You said at least we should have 7 to 8 hours of sleep. If you can't have it at a go, maybe can you have 5 hours, like intermittent sleep, like nap during the day for maybe 30 minutes, 1 hour in between. And at the end of the day, if you count it, it makes it up to 8 hours. Can you do that?
All right, thank you, ma'am.
Jazakumullah khairan for all those questions. So I'm going to merge a couple of them together. So for sleeping duration, yes. So the recommended number of hours for sleep is 7 to 8 hours. And the scientists would say that if you really sleep the way we are supposed to be sleeping, an average man would have slept 1/3 of his life, entire life. So yes, yes. So because that is how Allah has created us to be. Somebody who is 30 years should have slept for 10 years, minimum. So now there are sleeping disorders that may prevent us from being able to sleep, to have adequate sleep. So sleeping disorders, they are generally called insomnia. When you find it difficult to fall asleep. So there are various reasons, why that happens. So, of course, in some people, it has become a chronic condition, while in some people, it's just an acute state, probably as a result of stress, or as a result of maybe diet, or as a result of, sudden change in their routines, or, hormonal imbalances in women, for example, or women who have become, postmenopausal, who are not seeing, their menses again. Insomnia can be, one of those symptoms, that they would have. Now, how do we overcome it? So, of course, there are medications that can help to sleep, but we do not usually start with medications, especially for those of us who have got acute insomnia. It's not something that is there. It's just something that just started of recent and can be taken care of, can be controlled with proper activities. So usually what we encourage is that make sure anything that stresses you, you stop it several hours before. Make sure you take your bath, very important, before you sleep. Your dinner should be earlier, not eating dinner by 10 o'clock or 11 o'clock and you want to sleep immediately. Your dinner may have to, you may have to have it very early, say around 6 o'clock, and nothing after, and then we advise that you take you shower thereafter, and then you meditate as much as you can, and then hopefully that may help. But those are some advice with respect to practical ways. Some medications also help, but most of those medications you can't get them over the counter, so they have to be prescribed by a doctor. Zopiclone is a very good example, which GPs usually prescribe to help. There are some. Valium. Valium is also helpful. Is diazepam, but these are controlled medications, because if you misuse them, it can backfire. Yeah. In fact, in Nigeria, you don't even need prescription. You just sell Valium, they will sell it for you. It's not so here. So that is the advantage we've got. Some of those medications, some of them can affect our mental health. But some of them are actually used to treat psychotic patients. Psychotic patients need mental something close to that. So some of these medications are used to treat them. Not necessarily coins. Sometimes, when we have mood disorders is possibly you're depressed. You just find out that you're not happy. Maybe even if you're happy, you're only happy for a very short period. That mood takes over you again. Especially most of these mood disorders, mental, Islam, if we live our lives according to the dictate of the Quran and the Sunnah, they are natural ailments for some of this, ẹ ká wo Islam for example. Islam ti jẹ́ ká mọ̀ wípé tá bá ń lé nǹkan tó bá máa jẹ́ titi wa kò ní miss wa, tí ò bá ní jẹ́ titi wa kò ní bà wá. So Islam jẹ́ ká mọ̀ qadar pé this is al-qadar. A nígbàgbọ́ nínú kádàrá. Tọ́lọ́run bá fẹ́ kíní fún mi, màá ní, á ṣe é ṣe. Tí ò bá bọ́ sàn pé Ọlọ́run bá fẹ́ fún mi ni, àbí bóyá ibi ń bẹ ń bẹ, tọ́lọ́run bá fẹ́ mú kúrò fún mi, ni Ọlọ́run bá ṣe mú fún mi. So látara yẹn àti nírú àwọn gbọ̀gbọ́ bẹ́ẹ̀ yẹn. So kò nǹkan wà ní ìṣẹ̀lẹ̀ sí akáwọn ní orí ìyá mi o, orí ká máa wá bara jẹ́ ká máa. Ànábì sọ nínú hadith kan pé sallallahu alaihi wasallam as-sabr 'inda sadmatul ula, pé kéèyàn ṣe sùúrù, èèyàn máa mẹ́ni tó ṣe sùúrù nígbà àkọ́kọ́. Ìtumọ̀ yẹn ni pé bóyá ẹnìkan kú ń sìn tó close sí wa, bàbá ṣe nígbà tá a gbọ́ news yẹn, òun la fi máa mọ̀ bóyá ẹnìyẹn ní sùúrù àbí kò ní sùúrù. Ọlọ́run bá dẹ̀ sọ pé kí ni o, Ọlọ́run bá lóun ó nífẹ̀ẹ́ àwọn tó ṣe kí ni o, àwọn tó ṣe sùúrù. Inna Allaha ma'as sabirin. Ọlọ́run bá tún máa ń wà pẹ̀lú àwọn tó ṣe sùúrù. So nígbà tí a gbọ́ news pé ẹnìkan kú ń sìn, orí ìyá mi àti bárajá àti ṣe kíní, ìgbà tó wá dijọ́ kíní, mo gbà fọlọ́run. Ìgbà fọlọ́run yẹn is wrong. Ìgbà fọlọ́run nígbà tí news yẹn kọ́kọ́ ṣẹlẹ̀, ìtumọ̀ àdìs yẹn ni pé as-sabr 'inda sadmatul ula. Ìgbà tí kíní yẹn kọ́kọ́ ṣẹlẹ̀, bá ṣe conduct ara wa, bá ṣe gba news yẹn sí, bá ṣe react. So tí mùsùlùmí bá ní gbogbo àwọn àdábì, gbogbo àwọn etiquette yìí, kò ní ìtún move. Of course gẹ́gẹ́ bí ọmọ ìdí ènìyàn a máa banújẹ́, but kò wá ní move. Ẹ wo Gaza, ẹ wo àwọn ọmọ ìyá wa tí Israel tó ẹ wo àwọn ẹni bó ṣe, look at how strong they are. Ẹni tó ti lose him, tó lose ọmọ méjì mẹ́ta, a ní pé shahid ni wọ́n, pé shahid wọ́n ti, they are martyrs. Kí ni òun fẹ́ rò fún àwọn yẹn ti, they ended in the best way. So you see how they are practical way báwọn ṣe ń live ìgbésí ayé wọn. You see, so taba gbé ìgbésí ayé wa bẹ́ẹ̀ yẹn, our mental health wa would not be worried. Ẹ wọ àwọn tajọ ń gbé níbí báyìí, àwọn funfun tí pẹ́ pọ̀lọpọ̀ tí wọ́n ń ṣe mùsùlùmí, àmọ́ ò ní àwọn àjẹsára táwa mùsùlùmí ta ní ẹ̀. Òun ló fà tó já sí wípé wọ́n nígbàgbọ́ nínú kádàrá, wọ́n nígbàgbọ́ pé Ọlọ́run bá ló mú ilé wa, àbí wọ́n nígbàgbọ́ pé Ọlọ́run bá náà ló máa mú kúrò. Àwọn kan ń ṣe títí wọn lọ ni. So the sleep disorders, and we can request for medications if we really need it, and they can prescribe them for us. There are some natural means. There's this melatonin, which some people also find very useful because it's one of those hormones which are also produced. They stimulate our brain and can make us fall into what we call the non-REM sleep patterns. Undivided is what we call REM and non-REM. REM yẹn ni pé rapid eye movement. Ẹmọ tá a fẹ́ sùn tá a bá kọ́ ṣe báyìí, a ti ń sùn, but téèyàn kan bá, we are still easily rousable. Tí nǹkan kan bá ṣẹlẹ̀, bóyá nǹkan agbá large sound a lè tají pé kí ló ṣẹlẹ̀ mẹ́ẹ̀. So ìyẹn ni REM, ìyẹn ti ń tó rògbè. Non-REM yẹn ni pé everyone even kan máa kí lè máa jó gan tẹ́ ẹ̀ bá ṣọ́ra, ẹnìyẹn lè máa mọ̀ tẹ́ ẹ̀ bá so ìyẹn ni non-REM. So non-REM yẹn ni àwa tá bá ní sleeping disorders la máa ń sábà máa ń lack. REM wá pọ̀ ju non-REM lọ. So brain wave wa yẹn ó ṣì still, our brain should be sober to sleep and sleep very deeply. Well, obstructive sleep apnea, yes, it's also one of the causes of insomnia actually. Ìyẹn ni pé bí a ṣe mí tá à ń mí jáde tá à ń mí sínú, àwọn ẹlòmíràn tó já sí pé tó bá fẹ́ sùn báyìí, èémí wọn ìyẹn within their lungs, their bronchus, ó lè pa dédé bíi pé if care is not taken, ó máa ń pa àwọn ẹlòmíì because atẹ́gùn tó yẹ kó èémí tó yẹ kó lọ sínú á lọ sí lung á ṣe kíní is being obstructed. So irú yẹn náà ó máa ń fa kéèyàn máa rí oorun sùn dáadáa. So nǹkan tó yẹ ká ṣe ni pé ká rí àwọn GP wa kàn investigate why are we not sleeping. So tá bá ti mọ reason yẹn, it may be treatable. And then some medications may help at the initial stage, but it shouldn't be what we will now be over reliant on. So Wallahu alam. Sleep disorder is a disease on its own. So we have sleep specialists and we have sleep labs. Táwọn èèyàn máa ń ṣe studies oríṣiríṣi nípa sleep. So it's not just as easy as bí mo ṣe sọ yẹn. So it may require further deeper investigations to get to the roots of why. But these are the general ways tí a fi lè rí oorun. And then somebody asked about breaking the sleep duration. We can do that, but sleep 8 hours, táwọn ṣe onítàlẹ́ yẹn là ń sọ. Only 8 hours. Kò dí ti ọ̀sán táwọn bí to recommend fún wa pé ká sùn. So if you can do that, tá tún sùn ní alẹ́ better. But àmọ́ bí ìlú ìṣeré ọ̀sán yẹn most of us we are at work, so we may not be able to have that. But if we can, especially on weekends, why not? Let us do so. Ẹlẹ́ẹ̀kejì tí a béèrè nípa pé regular sex and prostate cancer. Yeah, so àwọn èèyàn máa ń sọ, they call it frequency of ejaculation, that it's been linked, the increased frequency of ejaculation has been linked to risk reduction for development of prostate cancer. Àwọn èèyàn máa ń sọ, even though some of those, there are studies that looked at this, but they are not entirely categorical in the sense that if you have less sex, you have more sex, you won't have prostate cancer. No, it's not directly so. But there are some studies, which I've also come across, and I've read some of those studies that showed that increased frequency of sex may lower prostate cancer risk. But I'm being very careful choosing my words, because so that we won't say, so prostate cancer. You know, I just mentioned the fact that you will be careful doing all of this and still come down with it. Yeah, there are people who are very careful, they're eating well, exercising well, they still, if they've got the genetics. Cancer, for example, kilo for cancer is just one cell in the body that just starts behaving abnormally. Several things happen in our body every second, every day. I'll give us practical examples. We are encouraged to always donate our blood. The reason is because if you don't donate it every 3 months, every 3 months, every 90 days, are replaced by new ones. The reticuloendothelial system, which are intimately related with the production of blood cells in the bone marrow, they are replenished every 90 days. So us donating blood is a good thing, because even though about donated old ones would go, new ones would come. Similar tabag after a while, what happens? Agunpada, isn't it? So there are some cells in the body that they rapidly divide. They always rapidly divide. Now, the way cancer happens is that you now have a cell, because it depends on which part of the body the cancer has developed from. Divide, could there duro from the natural body mechanism. But won't divide, ko aduro mo. Ofema divide law. So duro sibe. Ko fe onibo ganusi is not, it keeps dividing uncontrollably, not listening to the body's control mechanism. The body says, stop. No, I'm not stopping. Continue to divide. And that is how cancer starts. So, there are billions of such cell divisions that happen in different parts of our body. Billions every day. So now imagine just one of those divisions now goes haywire and then leads to cancer. So the fact we are cancer is just is Allah's rahmah. How it's just luck because you have billions of those divisions happening, and one of them will just say, "No, I'm not going the normal way. I want to go the unusual way." And even theory about Shelley Lara, there are bodies, there are defense mechanisms. I think apoptosis, I think necrosis. These are various ways by which cells that are dead within our body or that our body will find a way to remove them so that they won't be harmful to the body. But cancer will evade that mechanism so that they can continue their own. So with respect to the prostate cancer and regular sex, so that is how cervical cancer, we know that men who are promiscuous, bí a tán máa ń ṣe ṣìnà pẹ̀lú obìnrin oríṣiríṣi tán bá obìnrin who is not promiscuous tán bá lò, obìnrin yẹn might have an higher risks. Reason is pé cervical cancer has been traced to a virus called human papilloma virus, HPV. In over 95% of cases, human papilloma virus is the cause of cervical cancer. Now, HPV, there are different types. There's what we call carcinogenic among the HPV. Some are not carcinogenic. Some cause benign, like genital warts, for example. It's also caused by HPV, but genital warts is not cancer. It's just like an infection that can clear up with some viral treatments. But some types of HPV would predispose to cancer. So that's why if they isolate HPV, they will need to find what type of HPV is there. If it is type 6 and 9, for example, those ones are fine. But if it is type 18, type 33, those ones are the malignant ones. How man lead see cancer. We now know that if you give vaccines can help HPV, can help reduce them, thereby leading to development of leading to what's it called? Our curtail development of cervical cancer. So our vaccines still between 9 and 12 HPV vaccines. That is how they work. So they work against those human papilloma virus. So if a woman was sexually active, HPV vaccine may not be effective, but it's effective in those young boys, young girls who are not sexually active, because HPV is transmitted through sex. And HPV, there are different things. Cervical cancer is one of them. Penile cancer is one of them. Oropharyngeal cancer is also linked to human papilloma virus. So people are advocating to vaccinate several years down the line. They can curtail those malignant strains of those viruses that cause the cancer. So having no sex does not mean that one cannot develop cervical cancer, but it's a huge factor in the cause of cervical cancer. In fact, in some eunuchs need sex, especially among the Jews and all that. There are studies that show that those of them who abstain from sex or who don't have sex at all, they don't have cervical cancer. More so that we have said that it's actually linked with this human papilloma virus that is transferred through sexual means. So, there are some people they will say that, the fact that they're having oral sex. There was this popular man who had oropharyngeal cancer, and he came out to tell Britain, oral cancer regularly, oropharyngeal cancer oral sex rather regularly leads to oropharyngeal cancer because oropharyngeal cancer we now know that is linked. Even though oropharyngeal cancer also has types, it's not all of them that are linked to that. There are some that will develop with smoking, with alcohol, with betel nuts and other stuffs, but oral sex can predispose to that particular one. I'm on the HPV positive or P16 positive oropharyngeal cancer. Now, why black men have increased risk? Yes, we need more studies in Africa, in Nigeria, to find a kilo fa gun. Thomas Wele awani, Tabaso awani, kilo shele. So more studies are needed to unravel some of them. But most of our most of them are actually genetics. Genetics ni those are implicated. You know, we have genes that makes us to develop some certain diseases that are more aggressive, and we don't know why we have those genes. So, but more studies are taking place. Chinese medicine, Orthodox medicine, yes. The thing is, even I want to not all of them are bad. No, some of them are good. The only disadvantage we can't measure their dosage. Number one, we can't measure their side effects or interactions in the body. Most of our don't take more than 1 gram. More than 1 gram, it can shut your liver down or shut your kidney down. But how much is too much that will cause danger to the body? We don't know. And then, do they interact? Most of our juice juice side effect juice reduce so we need more research actually. So information we should abstain from them. Otherwise, they will cause more havoc to our body than good. The body mass, sharing most of our studies in they are done on Europeans, white Europeans, body mass index, but it still does not invalidate it in us. But there are some other ways of checking obesity. There's what we call waist circumference. So waist circumference here, it is said that for men, it should be less than 102 centimeters. Tabafe measure láàrin ìdodo síbi egungun ẹ̀gbẹ́ yìí. The distance láàrin méjèèjì la máa gbé tape rule sí. A máa measure around. So for male, it should be less than 102. For female, it should be less than 95. 90 to 95. In Asians, it's even far less. In Asians, waist circumference in women is around 80. In their males, it's around 90. So waist circumference is also one of the ways that if we measure obesity. But that BMI is an accurate means. And for those of us who think, we are in the overweight range, we should cut down. We shouldn't be adding more weight because the problem is not our height, it's the weight. So we need to cut down on our weight by fasting, by being more active and doing more exercises and moving. Keep it moving. Red meat, yes. Red meat is implicated in various diseases. It's implicated in colorectal cancer. We now know that. It's been linked to direct cancer. It's a carcinogenic agent, so we should avoid it. Now, the question is, I'm not being olive oil, avoid red meat, date. Those things are actually very healthy. They are very, very healthy. So we should adopt those lifestyle along with doctors about. If we think, and most times there's usually no conflict. If you think there's conflict, it's either you are not applying it the correct way. So if you think there's conflict, call your doctor, especially if you've got a Muslim doctor, for example, that you can seek advice from. Let them look into it and advise you properly. Lifestyle changes and high blood pressure. Yes. Even if your blood pressure is genetic, need delay. Lifestyle changes can lower it or can prevent you from having it. And think back about that example of gun and trigger that we talked about. So the gun is that your gene, the trigger is your lifestyle. If your lifestyle is very good, no trigger is pulled. So so if it is diagnosed, lifestyle may control it for a while, but àwọn oògùn Cure is, I wouldn't say cure. It can keep it in remission. Reason me verse cure ni wípé some people are in remission and they've actually been cured. But we doctors, we don't like using cured. Reason ni wípé if you tell somebody that they are cured, it means you've given them license to do anything that those people who don't have that disease can also do. Whereas doing those lifestyle may now tilt them down cliff and push them away, push them towards that disease again. But if they are diagnosed, they've started the medications, yes, they can be cured, or they can be in remission for a long while. In fact, I know people to just say, look, not initially. Not initially. You may have to use the medications for a long while. Once tobacco are well controlled. Okay. So we can but me fellow, I won't eat salt. I'll just be natural. No. That's not let's work with our doctors and over time. Exactly. Use the medications. No, lifestyle alone, no. Lifestyle alone, no. But over time, lifestyle may help. Yeah. But then choices of going without, chances of medications. Well, okay. Well, I think we've answered it. Yeah. So it keeps it in remission. We start. Sherry, problem tamani ni pe real tabani chronic disease. Tabati pe o tin wa well controlled and lọ fún check up mo. So and then we sleep, and then by the time that one check out it fema pada. But if you are consistent, lifestyle would carry it forward when we stop medications. But I wouldn't say start with lifestyle. Start with medications and lifestyle and be under periodic review of your doctors. Allah.
Takbir. I love that. But let me ask you, if you were to see a consultant in NHS, how loud will your takbir be? Takbir. And if suddenly you realize that the young-looking doctor has actually had about 17 years of experience and is apparently good at what he is doing, let us have a louder takbir. Takbir, Allahu Akbar Kabir. Thank you very much, Dr. RIDWAN. I think it cannot be better. This has been very resourceful and Brabola Imabo, I'm going to need it. Okay, you want to move around here. Permit me to appreciate the valuable presence of Dr. RIDWAN here among us. We hope we will see you again and again. Abere yin ti e ti lokun di baba alagbada yi tabati he we know we'll get you inshallah. So I know we have so many medical practitioners in the room. Chef Fishi Egboleni. Okay. Permit me to invite this Zonal FinSec, who is not a medical practitioner, such that it won't be seen as man no man. If I choose to call a doctor, it will look like Amfik Sheikh Bole, so I'm going to call someone who is not in that field. Alaja Shalewa, please come and present this to our very resourceful Dr. AHMED RIDWAN. The photographers, Brother Said.
The chairman. Thank you. Salam alaikum. One house, please. As the chairman has rightly thank you. Wa ò lè dúpẹ́ lọ́wọ́ yín, Ọlọ́run ọba ló máa bá wa dúpẹ́ lọ́wọ́ yín. Ọlọ́run ọba máa bá wa increase yín ní ìmọ̀. gbogbo nǹkan tẹ́ dẹ̀ ń ṣe ẹ̀ tó bá níbi tó dáa tó tún máa jù lọ òkè náà lè máa wá sí ètò ẹ̀dẹ̀ ń ṣe náà gbogbo àwọn fámìlì yín àti anywhere ọlọ́run á jẹ́ kí àwọn náà ní lára aládàá ẹ̀. So on behalf of Nasfat, UK and Highland Zone and the Family Retreat Committee, I present you this little gift. Eshe.
Please about get it back. And when we were still waiting for him, I said, Doctor, only chronic disease in Yeda. which is a very funny one in Yoruba. You know, when we see Iyaton Tata, we say Iyalata. So I was trying to use the adjective pé that man to ye come fún wa ní presentation lórí chronic disease. And I was saying, ṣé doctor ó ní chronic disease yẹn ò yí dé ní? Bí ipá àwọn náà ní chronic disease ẹ̀ ní mọ̀ àárẹ̀ lágbára Ọlọ́run, my brother. Ẹ máa kí ọ wọn, ẹ máa treat wọn ní o. Ẹ̀yin ò ní bá wọn gbóòórùn ẹ̀. Ẹ bá wọn get it back. Oníṣẹ́ Allahu Akbar. Yorùbá máa ṣòro. Yorùbá ó wá dùn lẹ́nu tí wọ́n báwọn ṣe ń sọ wọ́n ṣe ń fi sí àárín èbó yẹn. I really enjoyed it. So the MC, the anchorman.
Again, we are back at that crossroad again. We were given the opportunity to select between going on a 30-minute break and taking questions. The questions were quite good because it really helped and it threw some light to a lot of gray areas. So we thank the doctor and we thank our mothers and fathers for that sacrifice. You know, we'll move to the next event now, right?
Left, right, left.
Let us follow the sunnah of having a nap.
A nap, okay.
Maybe not a nap. Maybe 5 minutes nap.
Okay. Tafsan have some items here that are available for sale. Please feel free to come over and select and buy as much as you want. Organizers, please. Because on the group chat, it says that the next program is ongoing. So, I just need clarification. What I'm going program man.
I think our understanding is that Dr. Adekunle is substituting.
He's ready.
Dr. Adekunle is seated, but if the audience desires a short break, I think it will be refreshing.
Okay, let's take a 10-minute tea break, you know. Stretch your feet, you know, move your hand, move your body, get the numbers in. Elijah.